Hi, this is Kelly Busby, and we're going to talk about reading a case study now. There was a recent review of 10,000 articles, which is a lot of articles. They discovered that only 7% were actually case studies, and I'm going to explain why. Major reason is that an evidence-based medicine cannot take case studies too seriously. At best, you have a snapshot of a single patient or maybe a small cluster of patients and their treatment. Now, as we all know, not every bit of information about a patient is charted. So sometimes, say for instance, your patient who's being studied for a drug reaction, say for instance, during this study, he disconnected from the ventilator several times. He desatted, his heart rate went up, and the researcher didn't have access to your ventilator charting because he didn't maybe think to look there, or you didn't chart every single incident. Well, this would definitely affect the vital signs, and it could throw him off if he doesn't understand that something else is going on, because he's not got all the information like he would if he was in an experiment and he was watching a patient. Now, when a new disease is first reported, the tendency is to concentrate on unique aspects of this disease rather than the more common signs and symptoms. And we all know that all diseases, not every single patient has the most common side effects. Very few things are 100%. Another problem is when you're discussing a patient's response to a therapeutic action, you want to see what medicine or ventilator setting, it's not real helpful if there's no control population. You need to have someone with the exact same situation at the exact same stage who is not getting that new therapy so that you can look and see, would this patient have gotten better without the intervention if it had been given enough time? Even if written by an expert, you must use care making generalities out of just specific cases, and this is the problem with case studies. But there are some good things about case studies. There's advantages to writing up a brand new disease or an unusual complication in a common disorder. It helps educate. If a drug demonstrates an unexpected side effect, a series of case studies might act to audit the effect of the drug, and this might give us an early warning this therapy needs some attention. So we could say that a major advantage to a well-written case study is it creates enough interest to trigger a research question that could be explored in more depth by better types of research.